Welcome, and thank you for being here. My name is Karen Mikis, and I am a registered nurse and end of life specialist. I am also the host of In the Gap, a collection of stories from folks who stand in and work in the gap between life and death. Hello, everybody, and welcome to another episode of In the Gap. Today, my guest is Doug Gladstone. He is a paramedic, an educator, an assistant field operations supervisor. And all of this is at Sunstar Paramedics in Largo, Florida. Welcome. Welcome.
Hello, Karen. Thanks for having me.
You're welcome. I do have to let everybody in on a little secret. I have known Doug for probably close to 30 years, and we actually met at a little kind of volunteer opportunity for an ambulance corporation.
Yeah.
That was the good old days, as we refer to it.
Yeah.
Thank you. Thank you so much for being here. Tell our listeners a little bit about your journey to be a paramedic. What had you decide on that career path?
I had to fall into my lap, to be honest with you. We met at the ambulance company, but prior to that, I was in my hometown next door at the firefighter EMT. And I like medical more than fighting fire, so that's where we met. Did that for a few years, and we had a call with at the time, the director of AMR in New Haven, and hey, I like your work. I thought with your game, come next week if you want a job. I'm like, yeah. So went there, EMT for a long time. Then ended up with got paired up with a good friend of mine, Will, who pushed me to become a paramedic. So he trained me. He was my field training officer, helped me become the medic that I am. And it's funny, I still notice my teaching habits. It's like how he taught me and what he instilled in me, I instilled in my students. So it's like a crazy thing. But what really got me into EMS full time with my mom is the flexibility of the job. So I can still work, have that flexibility, and still take care of my mom. And then I
Great.
like with this mesh and stuck with the career.
Great. So you mentioned you were taking care of your mom. Did she needed a lot of help? What do you mean take care?
So she was diagnosed with pancreatic cancer. I was working full time at a 9 to 5 job, and I'm like, you know what? She's more important to me. I'm going to take care of her. Like I said, the EMS job gave me the flexibility to work nights, weekend, whatever, to work around what her needs were. And I did that for about 18 months until she passed away. And then was lost for a couple of years trying to figure things out. And again, the flexibility of the EMS job kept me going. And they're like, hey, why don't you do this full time? You know what? I enjoy it. Doesn't feel like a job. Why not? And it still doesn't feel like a job.
So
I
it's
still like
stuck,
all
huh?
these years.
What do you like about the job?
The fact that I can bring calmness to chaos. People don't call me for a cup of coffee. They're like, I'm hurt. I'm in pain. I'm sick. I need help. I can't breathe, whatever. And I can come in and I can fix them or help them. If I can't fix them, but help calm them down or stabilize them, get to the hospital. And just to bring that calmness and that order to the chaos. And I see a lot of people just, I'm here. Oh, they got it. Help us here.
Yeah.
Now we're calming down. Now I'm not so anxious.
Yeah.
Oh, what we gotta do? Let's do this. We'll get you going. We'll get you feeling better. That kind of thing. And
Yeah.
I will enjoy with my critical patient the turnaround that I can do with them.
Yeah.
Especially my respiratory patient. They can't breathe. I'm sure you know about the death grip that they hold on to, but they can't breathe.
Yeah.
Don't. And I can do my thing, and 20 minutes later, we're cracking jokes. That's like
Yeah.
the best feeling in the world. to have that turnaround in the 20 minutes I'm with them.
Yeah. Yeah. And how often is it that's not the case? That you're not able to help that person breathe better or alleviate their chest pain? What would you say is your success rate, let's say?
Um,
And how do you measure success as a paramedic?
wow.
Sorry.
No, it's
Tough question
hard,
interview.
no, it's hard to put the success rate on it because down there in Florida, we got the older population, so they have just respiratory illnesses. Really, I'm just stabilizing them for that acute moment, but my drug's a little bit stronger than what they have, and I can alleviate them, give them the steroids, get them held over to the hospital to finish their steroid treatment or breathing treatment, and they get discharged.
Mm.
But for those patients that are more severe, more terminal, all I can do is make them comfortable, and that's part of my job. Yeah, I can help with the breathing issue, but I can at least make you comfortable, so you're not struggling as hard as you were before. It, like COPD, it's a disease process. Eventually, it's, it's to me, it's terminal, and when you get to that point where you can't breathe at all, I'll make it comfortable. So you're not.
Do you have those conversations with your patients?
It depends. Usually they already know, and they're just like, I just need to be comfortable. I just need to be able to take a breath. Or if they're, I don't know how to describe it. I almost want to say if they're not ready or if they haven't accepted yet, they want things done right, and
Yeah.
then the education part comes in. Unfortunately, it's where you're at with your disease. I can only do so much. This is what I'm gonna, I say throw at you, but if my treatment I can give you, my medication I can give you, I can bring you to the hospital, it's the best I can do. Now I'm gonna help you, even knowing that they're getting the help to alleviate their anxiety, which turns up their breathing. It's had that domino effect.
Yeah, so what I hear is you're actually one of the first treatments is connecting with the patient, finding out what it is that they want. If it's that chronic, you said COPD or who just wants to take that next breath, you're in there working with them so that your goals are their goals as well. Is that
Exactly.
fair?
Yeah, exactly. It's same thing with cardiac chest pain. My chest hurt. All right, let's figure out why. I'm not seeing anything, but here's what I'm going to give you. Are you feeling
Yeah.
better? Okay. Do you want to go to the hospital now? Yes, you
Yeah.
do. And that's the other part of it is I had a patient this morning who didn't want to go to the hospital, but she needed to. Um, and it was a simple fall blood thinner type thing. She had a couple of pains here and there, and we're like, you really need to go. You're hurting here and here. All right, that type of thing. But you also got to take a look at the patient. This woman, 94 years old, shot at the tag.
Yeah.
Yeah, 16 grandkids, 36 great grandkids. You can name all of them.
Uh,
And she just stopped driving last year because of a foot injury. So can you imagine the environment that she grew up. So a tough exterior personality type. But when I get into the hospital, get her all anxious settled on the warm blanket, all that kind of stuff. She's happy, she's content. I give report to the nurse. You can see her holding her head. So you know she's hurt. Yeah. I made the right choice.
yeah.
You get what she needs. You know, she would be stubborn, if you will, whatever, but how she grew up. But it's some you gotta be a patient advocate. Whether it's something like that or some cardiac or simple I need surgery to my head type thing, whatever.
So you mentioned that you're in Florida and there's a older population. So it just begs me to ask the question, how many times are you going in and these folks are already gone? Like they've already passed.
Um,
What does that scenario look like?
we actually get those calls on a daily basis. Not me personally. Yeah, it's funny that we're talking to me on one today, but And it's funny that you mentioned the elderly population, but it's not just the elderly population. It's all ages. Unfortunately, but I'll still back to your question. But unfortunately, we do have a overdose drug problem here too.
Yeah.
30 to 20, 30, 40-year-olds that are overdosing that already passed away. And then they got the elderly that it was their time and they passed away. So back to your question, a lot of times it's expected by the caller, whether it's a family member or something like, hey, my mom passed away. And they don't know what to do. They call 911, but they don't know what to do.
Yeah.
Go over there, confirm, yeah, no, your grandma, whatever, passed away. I'm sorry. What can we do for you? In my county that I work in, our process is we have to have law enforcement come on scene, like a chain of custody issue.
Yeah.
Um,
You're not allowed to pronounce on scene. Is that correct?
I can pronounce on scene if it's obvious,
Yeah.
but if it's something that we did attempted resuscitation with, we actually call our medical control doctor. And this is what we got. This is what we did. This is what was shown. We want to cease efforts because they've been asystolic the whole time. The capnography been zero. There's no sign of life. Authorize it. Or if there's something that they wanted to try to do before we call it, hey, give another amount of epi or give sodium bicarb or whatever. That doesn't work after 10 minutes, then yeah, you can call it.
And what's the next step after that? You have to call the police, or they're already.
Well, usually they're already notified for a timely death. So they come on scene and so we're a dual agency with fire and ambulance, who I work for. So if like whoever gets on scene first has primary custody, if you will, we work with whatever. So if I'm first on scene, I have to wait for law enforcement. If fire gets on scene first, they have to wait for law enforcement.
Yeah.
And it's more to make sure that there isn't any foul play or there isn't any crime committed or anything like that. It's
Yeah.
not
Yeah.
that. And then the work with the family, with nursing home, the ME or funeral home, or whatever arrangement need to be made.
So the police will call the funeral home or the ME or whoever.
Yeah, or whoever.
Yeah.
And also a lot of the time, these folks, especially the elderly population, they're already widowed.
Mm,
You may not have family members.
yeah.
Will get called and they'll try to reach out to family, to his family, try to figure out what arrangements are made, maybe do a search of the home, the resident to see if there's a funeral home listed or whatever.
Do you ever struggle justifying, like, say you have a 90-year-old gentleman who's passed naturally at home versus the 30-year-old gentleman who, say, overdosed due to drug problems? Do you even deal with the emotion of that, or do you compartmentalize all that? How does one deal with that when it's an ongoing, everyday kind of occurrence?
I would compartmentalize it. Also, my faith also helped me work through the process. I maybe silly, but I always do a little prayer for the person. I'm like, like my thing that I do. Like for the 90-year-old gentleman, okay, he's 90, he had a long life, whatever, it was his time, whatever. For the 30-year-old, okay, and it's gonna sound a little bit morbid how I deal with it, but it's I don't have sympathy for them because you have to do the drug addiction, you have to do the J's, but they still did it to themselves. And yeah, I feel bad for the family, not the person, it's himself, but it's you did it to yourself. So maybe it doesn't affect me as much, or maybe I don't think it does, but it really does because I think that way about them. But even those folks, is that do a little prayer for them, give them a blessing, watch them as they go to their final resting place type thing.
Yeah. It's drug addiction is the disease, and it's a whole nother podcast, Doug.
And I'm sorry again. I'm giving you yeah.
And listen, what I want to know is what is The most challenging aspect of dealing with death and dying in the emergency first responder type setting, what is the most challenging thing about all of them?
Honestly, for me, it's the family members, especially for an older couple that been married for 50, 60 years and seeing the spouse of the deceased react. And I've seen various reactions. Some are full on grieving, crying, screaming, to very stoic, very frank face. Okay, he's dead. Okay. Like, and it's the range of emotion that people display. And I can't judge because I don't know them, I don't know their relation, but it's amazing how remember one call where the gentleman passed away. We started working him, and the wife was in the room, and she knew what was going on. The gentleman was terminal, and then she finally was like, just stop. It was his time, just stop. And so we honored her request, and she was upset, she cried, that kind of stuff, but you can also see a little relief on her where he's not suffering anymore.
Yeah.
But yeah, is the family member is, especially the older couples, they've been together for so long. Okay, I've been with this person 50, 60 years. Now they're gone. What's my life gonna be like?
Do they
Yeah.
ask you that question right there?
Not verbally, but you can see their expression.
Yeah.
Right? You can see the excuse me. You can see the loss. Sorry. Lose their voice when they have a cue shut down your food. You can see their expression. You can see the devastation on them.
Yeah.
Right? Whether it expected terminal illness or sudden death scenario is they have that. Hard to describe it. It's
Is
like a
it
depression bug.
yeah, is it
I lost my life partner. I lost my best friend. Where do I go from here?
yeah,
I'm like that lost look.
yeah. Is it the most challenging part for you to be with that person, that look, because that look and that is familiar to you?
It is hard. No matter how many times I see it, it's still hard. Could you really don't know them, so you don't know. You have to choose your words carefully. Could you want to say the wrong thing about the person, the deceased, and so you want to feel them out a little bit. Tell me about your loved one, and some of them want to give a life history. Right? Wow, really? Wow, that's interesting. Okay, so he was a big shot at Chevron, and you moved state to state. Wow, that's pretty awesome.
Yeah.
What was your favorite state that you lived in? California. Okay, great. What did you like about it? Where about California? It's just like they're sharing the memory and they feel a little sense of relief and also like a distraction of what just happened.
Yeah.
Yeah, but and it's unfortunate I'm only there for maybe 20, 30 minutes. And then I have to leave to do one another call.
Yeah,
And
but
they're stuck.
it could be a very impactful 20, 30 minutes.
Yeah, for sure.
It occurs to me that you've created this balance between being empathetic and engaged versus like detached and protecting yourself from that
Yeah.
that loss and that devastation.
Yeah. And I do have to check myself and even at focus
Mhm.
on that because if we took every one of these calls home with us, you'd be right.
Yeah. Which leads me right to my next question
Oh boy.
is how do you decompress? How do you manage the stress? I know that you work, 60 hours a week and that's a light week. Huh, yeah. Yeah. So how do you decompress? I see you got your puppy.
Yeah, I got my puppy. I've always had puppies that usually don't go more than 6 months in between dogs. So that big really for me to come home and, like with this one, he'll bring me a tray and we have to do a 5-minute play before he goes out. Thankfully, I got a dog walker for him, but they sense it. If you had to look at all my dogs, they sense, oh, you need some love. Like, I'm coming at you, pet me, give me some love type thing. That helps a lot on the day-to-day basis. But there's other activities, like my cycling that I do. That's always been my therapy. Whether take a day off, I gotta get back into it. I really do. I promised myself once the weather cools down, which is starting to do. But no, bike on the trail for 80 miles. Yeah, that's my biggest therapy. Or I sit in my backyard. I got lake in my backyard, listen to stars. It's my own oasis. And again, for back to my beliefs, I do a lot of meditation as well. And it helps me put the pieces together. It helps me accept what happened. I did what I can do. I did everything in my powers. And knowing that I did what I could do helps a lot too.
Yeah.
So all those factors come into play. And it's funny, one of the things I do when I leave work, you have to go through a gate to a parking lot. I mentally at the gate will be like, all right, everything stays here. You're not coming home with me. Once I close the gate, it stays at work.
Yeah.
And that when I commute home, if there's a real bad call, I might review a little bit or listen to my music or whatnot. But by the time I get home, what transpired at the end of the day is done for the most part.
That's great. That's a real skill you got there. I know too many
Took a lot
people
of
that
years.
do that.
Yeah, it took a lot of years to build that skill. I think part of it, to talk about the old days, we worked together in the we had some bad cases come in. Those cases still haunt me. This one in particular that still haunts me to this day. But I think since I've learned these skills, calls don't haunt me. So it's the earlier calls in my career that haunts me. Calls now, not so much.
Yeah. Why do you think that is?
I think it's just experience level, deeper religions level, deeper understanding of humanity, and also my personal experience with my personal loss. Kind of also put things into perspective.
Yeah. You mentioned, I guess I mentioned that you were an educator and that you have the opportunity to influence up and coming paramedics. Do
Yes.
you include any kind of conversation or module about dying or death in the field or something along those lines?
I do. We don't, unfortunately, it's not like a specific module that is taught the paramedic program, but all my students come on my truck because I'm one of two college preceptors, so they have to go through me. So I integrate the training on bus, on the ambulance method. I make it their class. And I do have these conversations with my students. I'm like, you're going to have some bad calls. You're going to have this is what we're going to deal with. And fortunately, or unfortunately, however you want to say it, they do get that experience when they ride with me. And we do a debriefing. We actually call it, shoot, it's like a hot something or other, but it's a right then and there debrief right after the call. And I'm like, all right, what went wrong? What went well? What do you think? All right, that's the patient. What about the family?
Yeah.
Because they don't know. And
Yeah.
I go, you have to take care of the family. This is what we got to worry about. And then I'm like, all right, how about you? Yeah, I'm fine. I'm like, are you sure?
Yeah.
It's one student. I don't know how he made it through it, but his first ride along at an EMP was a gunshot. Patient was multiple shots, whatever, transported to the ER, so we did our thing. And we're in the trauma room. And of course, you wouldn't expect this from me, but the doc's like, I need somebody who had gloves on him to do a chest tube. My student had it. And you got a bird's eye view of the chest tube and all that kind of stuff. And then after the call, like, all right, You have people start, yeah, it's great. Oh my gosh, I saw all this stuff. Blah, blah. I'm like, all right, how are you? What do you mean? How are you? This is your first major trauma in your EMS career. You're 20 years old. How are you?
Yeah.
I'm okay. I'm okay. So I kept tapped on him, but he's fine. He is now, this was like maybe 4 or 5 years ago. And he's now one of the medics in the fire department, and he's doing well.
Great.
I find having these conversations with my students, they're better prepared. And because I've been teaching since before COVID hit, so probably about 4 or 5 years now. A lot of medics in my county are my former students.
Yeah.
So I'm spreading my
Your wisdom.
yes, my wisdom for this county.
Yes.
One reason why I like to teach, because go back to what I said earlier with my friend Will, when he taught me all this stuff, and for me to be able to pass that along, and I do that in his honor, but he passed away a few years ago. So that's why I enjoy it.
Yeah.
And they enjoy it too, because we're engaged. It's not you sit in the back of the truck for 12 hours. I get them engaged, I get them moving, and they enjoy that.
Yeah. Doug, I thank you. I'm just so filled with gratitude that somebody like you, a human being like you, somebody who is willing to get into the muck of humanity and make it better, not only for the patient, but for the families too. And your willingness to pass along this wisdom of 20 plus years in EMS is just, it's selfless. And I really appreciate that. And just don't stop. We need you. We need you out there making the
But I gotta
impact.
retire soon. Come on.
We'll talk about that later. That's another podcast.
Okay. All right. I'll keep going then. I won't stop.
All right, my friend. I love you. Thank
I
you
love
for
you.
being here. Thank you for joining me as we explored the lives, the jobs, and the stories from the experts who spend their time in the gap. This show and all of our shows are live streamed to your favorite podcast platform.